Hello, my beautiful people. All right, good evening, everyone. I'm Dr. Joaquin Acosta, your guide and host for tonight's Know Your Pharmacist live stream. As the CEO of PharmTrue and a passionate advocate for transformative healthcare, I'm thrilled to welcome you to a session brimming with insights, innovation, and inspiration. Tonight, we're embarking on a journey through the fascinating world of healthcare where every discovery and discussion brings us closer to a future of wellness and understanding. We'll explore the latest developments and tackle some of the most pressing health issues of our time. Starting in our Pharmacist Frontline segment, we're going to delve into the rising flu-like illnesses in New Mexico, understanding its impact and the crucial role of vaccinations. It's a topic that touches each of us, and I'm here to unravel the complexities and offer clear, actionable advice. Tech Talk takes us into the realm of Amazon Web Services and their innovative approach to combating clinical burnout. It's a testament to how technology can be a powerful ally in enhancing healthcare delivery and provider well-being. Our Enlightenment Hour is particularly close to my heart. We'll discuss the groundbreaking malaria vaccine and its potential to save thousands of lives in Africa. A story of hope, resilience, and the power of scientific innovation. In our Herbal Wellness Corner, reflecting on High Horse Cannabis Company's remarkable year today in the final episode of Season 1, episode number 14 of the Full Spectrum podcast, which I recorded with Bennett earlier today. We celebrated High Horse Cannabis Company's achievements and even looked ahead to the exciting prospects of 2024, the journey of growth, community, and the transformative power of cannabis. And in our community spotlight, we're all about the celebration and giving back. We're going to highlight High Horse Cannabis Company's New Year's giveaway, a fantastic opportunity to start 2024 with positivity and excitement. Finally, in our Men's Health Minute, we will offer intriguing insights from a recent study on the impact of women's tears on male aggression. It's a fascinating glimpse into the interplay of biology and behavior. As we navigate these topics, I invite you to engage, question, and learn with us. Your participation makes this journey richer and more meaningful. Together, let's embrace the power of knowledge, compassion, and innovation in healthcare. Thank you, everybody, for joining me on this journey towards a healthier, more enlightened tomorrow. Starting this thing off, I'm going to share some New Mexico flu data with y'all. And again, this is right actually before we went into that winter holiday. Here it goes. Little mini one, bigger one. Oh, got it down below now. So New Mexico influenza and respiratory disease report. So RSV season, December, January, that transitional time is supposed to be the highest time for that. I'm particularly more thinking about RSV rather than flu, having an infant right now, but that's just me in particular. RSV is still, important for all your older adults to your most vulnerable. And again, flu and COVID are still out there. So we were all anticipating the viruses and the viral activity being up. Well, guys, our United States influenza-like illness is 5.1% above the national influenza-like illness baseline of 2.9%. So 5.1% there for us in New Mexico. Yes, we are a little high. And considering this was influenza season week 50, guys, after the holidays with a good 2-week incubation period, you are going to see the probably peak of our flu, COVID, RSV season right now for the 23-24 season. Again, still time to get vaccinated if you haven't been vaccinated. It's not going to work if you've already contracted it and got the vaccine after, but you could still be ahead of time and perhaps protect yourself if you really need to. Definitely highly encourage that role of the vaccine. Definitely want to, try to get everybody getting it as much as possible. And where we talk about that there, you have to kind of be ahead of time, that perfect time to get those, flu vaccine this year. Most years kind of going to be the mid-October time. Still can get it. You definitely obviously want to get that in your system, get those antibodies up before that Thanksgiving holiday, traveling thus, so on and so forth, even after that. So very much things to be mindful of, but right now, guys, we're going to definitely see the cases of flu being up. a lot of people calling in for work, things like that happening right now. And right here at this transitional period between December and January, always considers, our data is always peaking in here over the last 3 years, right? So, right now, Doñana County's where I'm at, where we're at, it's a little dark red, right? Very high. So I don't know what that pulse is for today by any means, but this is our most current data of the 16th of December, 2023. All right, so what can you do? Still, you could get your flu shot. Definitely, obviously, if you've got some sort of symptoms of any kind, you're washing your hands and mindful of your, cough and droplets, the general courtesy. Always want to remind those things for sure. But again, here we are. So, you guys, some of those immune booster things, if you're going to be drinking anything like that, I like Airborne, recommend, generic style of Airborne. You're going to hit a nice little immune booster. Those of you who use herbs and things like that, more power to you. I don't know a whole lot about that stuff. But again, vitamin D is critical right now where most people are not getting a lot of vitamin D being outside. It's getting very cold. So if you're not getting that, that can have other effects on your immune system, right? As we saw in COVID and the cases of COVID that were really starting to hit people differently when they had that lower vitamin D count. And so, where you look at kind of the whole and the parts of the whole, I think, again, staying on top of your rest, staying on top of your, exercise and your steps if you can, right? Pushing for all that, and rolling a good dice, I think, gets most people to a really safe position through the flu season, COVID season, RSV season. But for your most, vulnerable out there, guys, those are the people we got to be extra careful for. This isn't a cry for everybody to go get vaccinated right now, even if only 25% of the state had gotten the flu shot as of 2 weeks ago. So, we can only do the best we can. Be mindful of it. Again, traveling, gathering, separating, incubating, getting sick, going back to school, same old little cycle there. May not happen to everybody, but things to be aware of. Try to get ahead of that. For those of you parents who don't know, Little Steps Pediatrics, just want to shout them out. They're open from 5 to 9, like every single evening. Night clinic, really great for after work, after you're done with your day. You have to still go, especially in that window of time, right? It's a great little time to, perhaps coordinate maybe getting your child seen versus trying to have to take off of work or something like that, right? And of course, you want to take off work and get up, get there right away and do all that. But the realities of it, people do have lives to live and things like that. So I think that's a really good thing here for our town to offer that little, pediatric urgent care style deal there. Otherwise, you're going to the ER and you're playing all those games. And healthcare access is a huge thing. So we want to shout out those who are helping make it more accessible. Little Steps Pediatrics, obviously near and dear to my heart there. Shout out to Megan Robinson and the team. Guys, moving on. Amazon Web Services targets burnout with new clinical documentation tools. So I don't know if we had talked about a whole lot of this particular Health Scribe one yet, but I think, Health Scribe from Amazon Web Services is a very, very, awesome target for your physicians, because physicians can literally thus plug into their electronic health records and review clinical notes that have been, literally just generated from a written or from a transcript that was recorded right between the patient and provider, and where that technology is really, really starting to become extra available, right? You've got Amazon Web Services Health Scribe, you've got Google Med Palm 2 and the technology that's coming out of that, or the ones that are going to be merging with the electronic health records and kind of starting to get us to this really excellent, single pane of glass, granular view of healthcare, and ways to make it better and ways to already, enjoy it better as healthcare providers and a healthcare system and a healthcare team all around. So shout out to Amazon for targeting, physician burnout there, because, where you look at that, again, if you're not at the top of your game, you're not able to, perform at the best of your game. If you're sitting there, doing patient visits every 10 minutes, in and out, you may or may not have had a scribe for the day, and you're still got to go chart your notes. Again, that quality of those notes all of a sudden changes big time. Your scribe gets, less off of their plate, and all of a sudden you get to spend more time with your patients. I think that, in general of a 2023 AI innovation and targeting, I think Amazon Web Services found a pain point there for the healthcare industry, and I think they did a good job, in terms of creating this health scribe platform. Very interested to see how it integrates with electronic health records, or if hospitals, even in our local area, are starting to do it sooner rather than later. Again, you still got to look at how those systems get implemented, what the kind of costs, and who's going to be able to understand it, so on and so forth. And you want to be able to train people on it really fast. But again, you've got your average maybe healthcare employee in a hospital, right? What do you think their age might be? Really, those people that are lifers or that are your most tenured people, they're probably a little older. So it's even that much harder to get some adoption there. So if you can create a platform that can be very supportive, allow providers to work at the top of their license, I think boom, boom, and boom. Excited to see what the space race of healthcare is here in 2024 between the big boys here, especially Amazon, Google, ChatGPT. It's going to be insane, and I'm freaking ready for it, guys. I can't wait. So, all right, I'm going to share with you next another 2023 big breakthrough, right? We're looking at a new malaria vaccine that had been developed in Africa, hopefully with the potential to save thousands of lives of children. So let's talk a little bit about the vaccine. So, this is back in October, I believe, from the release of the article here. But, it's building off of what's still to come, right? So every year, 25 million children are born in African countries where malaria is endemic. Of them, 500,000 die annually from the disease transmitted by mosquitoes. In October 2021, a 4-dose vaccine was approved that can reduce the symptomatic disease by 75%, but manufacturing it is slow. And the serum is currently limited to about 18 million annual injections. So this allows only 4.5 million minors to complete the course of the vaccines, because again, it'd be a 4, right? So the World Health Organization has this week, and that was back in October, recommended a second, cheaper drug with similar effectiveness that can relieve the bottleneck so that vaccinations can reach the majority of African children who need them. So developed by the University of Oxford, the new drug is called the R21 Matrix M and will be produced by the Serum Institute of India, the largest vaccine manufacturer in the world. In summer of 2024, the first vials are expected to leave the factory, which has the capacity to produce 100 million doses per year and can be scaled to 200 million. Company CEO Adar Poonawalla believes that by the end of 2024, there will no longer be an imbalance between demand and supply. Its main production advantages, explains Regina Rabinovich, director of Malaria Elimination Initiative at the ISG Global Health Institute, are that it uses an adjuvant, a substance that enhances the immune response that is easier to obtain and requires less of the main active ingredient to get a very similar response to the first vaccine, which was recommended by the WHO. So Mosquirix, produced by GSK. It's going to decrease the price. Price is going to be looking at between $2.10 and $4.20 per dose. So again, that's approximately half as much as the prior vaccines. Huge leap in protection against the parasite Plasmodium falciparum, which is the most aggressive and widespread in Africa, causing 90% of deaths from malaria. Experts hope that the new drug will help continue to reduce the number of deaths from malaria, which had been falling in recent decades, but rebounded in 2020 as a result of the COVID-19 pandemic. So According to the latest data available, is estimated 2021 there would be about 247 million cases and that 619,000 people will die from malaria worldwide. Although it's a reduction of 6,000 deaths compared to the previous year, still considerably higher than the 568K estimated in 2019. So, guys, things to look forward to in 2024. This new malaria vaccine coming out and hopefully really getting that number of expected deaths from malaria down in Africa. I mean, we're better than that, right? If you can create a vaccine for COVID-19 and have enough for everybody in the entire world to have 15 of them, and granted, that's an over-exaggeration. I still advocate for the vaccine. It worked, right? Some people understand. I understand and empathize with feeling a little overdone by it, of course, but we were in a pandemic, so a lot to kind of digest there. But I'm glad to see that the vaccine did end up being able to scale up. It deserved to be able to have that, access for Africa, who's obviously been battling malaria for a long time. And it's crazy how fast we can sit there and address a worldwide pandemic, which needed to be addressed. But keep that same energy going, Pfizer, you'd think, right? Just because there's probably not a lot of U.S. healthcare dollars in there and whatever else you can take advantage of. But, there's a problem with people that need healthcare. Anyways, I'll get off my high horse there and jump onto my high horse here. Sharon, today me and Bennett went through the last episode of this season's Full Spectrum podcast for High Horse Cannabis Company. Pretty awesome, guys. We got to talk about the transformative year High Horse Cannabis got to have. They literally were all over the place. And for those of you guys who saw High Horse everywhere, we were sharing some of those memories. I jumped on into the company in July, so I didn't even participate in all of this, right? So checking it out, right? It's very, very cool. Celebrity budtenders, guys. Mr. Capone, Afro Man, Bone Party for First Thursday, Mimosa Market, Pizza Fest. Heck of a year for High Horse Cannabis Company. And not only just parties, advocacy, going from 2 stores to 4 stores, doing a whole heck of a lot. Shout out to High Horse. And in our community spotlight tonight, guys, we are going to actually talk about High Horse's deals for New Year's. I want to make sure everybody gets to see this. High Horse Cannabis Company is having a New Year's giveaway, everybody. So on January 1st, 2024, the first 42 customers through the door on January 1st, 2024 will receive a 1 penny pre-roll with every purchase all year long at all locations. And also the first 420 customers through the door on January 1st will be entered to win a penny pre-roll with every purchase all year long at all locations too. So crazy value there, guys. I know sometimes, Chick-fil-A and these other stores will come in and give out Chick-fil-A sandwiches for a year, but penny pre-rolls for a year with every purchase is pretty awesome there for all of you guys who appreciate such dosage forms. All right, lastly, an interesting headline I saw one today. Sniffing women's tears may reduce aggression in men, study finds. So the findings, which may extend all humans, suggest emotional tears may serve an evolutionary purpose. Human tears contain an odorless chemical substance that reduces aggression. So this study found tears often spur feelings of empathy between people, but a recent study shows they may bring about this effect in more ways than one. Sniffing women's tears may reduce aggression in men, suggesting a protective purpose for the emotional response. Researchers found that after smelling women's tears, men experience reductions in aggression by more than 40%, as assessed through levels of aggressive behavior and brain activity. The scientists say this conclusion, published last week in PLOS Biology, may extend to all human tears. All right, so a little more about it. The findings suggest that the tears are a chemical blanket offering protection against aggression, and that this effect is common to rodents and humans, and perhaps to other mammals as well. And through limited research, examining the realm of human chemosignaling, Noel, the neurobiologist here, his lab previously observed that women's tears lowered men's testosterone levels, physiological indicators of arousal, and self-reported sexual arousal. So they knew that sniffing tears lowers testosterone, and by lowering testosterone has a greater effect on aggression in men than women. So then began studying the impact of tears on men because it gave you a higher chance of seeing an effect, right? So, humans as a whole host of odors and chemicals emitted by other humans that provide social cues, often unconsciously. Previous research suggests people may smell fear and anxiety from others, and evidence support that the idea that sweat can also convey emotional information. Chemical communication between species happens as well. Dogs appear to pick up on human chemosignals and indicating different emotions such as happiness and fear. So, how to test it? They tested it. Authors collected emotional tears from 6 female donors aged 22 to 25. The members of a small sample group were the only ones of over 100 volunteers who were able to produce enough tears for the study. So will tell Scientific American's Rachel Newer that the tear collection proved a big challenge to the team, and they need a lot to provide at least 1 millimeter of tears to each male participant, which is a lot of tears. Anyways, further, the watery droplets could not be induced by methods such as cutting onions, which produce a different kind of tear than is generated by watching sad movies. So, anyways, 25 male volunteers then played a video game designed to incite aggression. The participants played a computer algorithm against a computer algorithm opponent, but were led to believe it was a cheating human player. The scientists measured the men's aggression by calculating the number of times they chose to take revenge against the opponent. In a second part of the experiment, 26 men played the same game on a magnetic resonance imaging scanner, MRI, that monitored their brain activity. In both experiments, the participants sniffed either female tears or a saline solution, both which are odorless, and were not told what they were inhaling. The men displayed 43.7% fewer aggressive behaviors after smelling the women's tears than when compared to the saline control. Further, 2 brain regions related to aggression and decision-making, the prefrontal cortex and the left anterior insula, showed significantly less activity after men smelled tears. So, connections to the amygdala, part of the brain responsible for emotions and olfaction, increased as well. Well, guys, or women, next time you're watching that scary movie, pocket those tears, get a little perfume on it. If your guy's a little bit, too riled up. Just kidding, but that's very interesting, right? Very, very, very interesting. Life is crazy, and we barely even know it. Ain't anything about it. Hope everybody has a good night. Happy hump day.